All right, the latest upswell in COVID cases here in Western New York is now hitting our local hospitals hard once again.
And they're making an urgent plea to those who have not been vaccinated to do so to keep them from being overrun. Channel 2's Ron Plant spoke with a local hospital manager today for an update. Ron?
Scott, Mary Alice, it seems our local hospitals being hit from all sides as they try to weather the storm. Maybe call it the hurricane of COVID, considering the impact. With Erie County showing a COVID caseload over 200 now for local hospitals, they're being slammed and seeking out ways to deal with it in terms of the physical plants and stress and strain on their staff and resources. Now, we did not get a response from Kaleida today, but the affiliated Erie County Medical Center's Associate Medical Director did discuss their overall situation right now. Our harsher winter weather means they're probably not going to be able to easily set up tents outside or even use parking garages for space like hospitals have done elsewhere. So there is a backup in the ERs as well now. That's been the case for a while, and it could get worse. So he sees vaccination as the only way to get out of this COVID ordeal.
We are all full. And so we don't really have additional space or nursing capacity to take care of a bunch of new COVID patients going into the winter. So, that's why we are really pushing as the healthcare professionals vaccination, because, we simply don't have physical space to put more patients right now. I think New York City has demonstrated what happens when almost all the adults, literally, I think they're about 97% of people above the age of 18 have been vaccinated. And thus New York City does not have the hospital crunch with COVID patients that we are staring down here in Western New York.
Now, Catholic Health, you may remember this, actually set up a COVID-only hospital last year at the St. Joseph's campus and handled some 2,100 cases before that specific mission ended in May. But a spokeswoman says more difficult staffing shortages rule out that option right now as they're focusing on covering their primary hospitals. We must also point out the lingering after effect with patient diversion from last month's Mercy strike there is still hitting ECMC quite a bit. And with the winter coming and again that Delta variant still out there, it's just not a great outlook for those local hospitals right now. Ron Plants, Channel 2 News.